Good day, class. You are welcome to study section 11 of pharmacodynamics and chemotherapy, which is toxicology, introduction. Toxicology is a science that combines biology and chemistry to study poisons and their effects on biological system. Poisoning occurs when any substance interferes with normal body function after it is swallowed, inhaled, injected, or absorbed. The branch of medicine that deals with the detection and treatment of poison is known as toxicology. This study session will introduce students to the concept of poisoning, its causes, how it can be recognized, prevented, and managed before it gets to a stage when the situation can no longer be put under control. The learning outcome. When you have studied this study session, you should be able to describe the incidents and types of poisoning. You should also be able to needles, bark seeds, and berries. In other plants, only certain parts are poisonous. The bulb of the hyacinth and the daffodils are toxic. Both the flowers are not, but the flowers are not. While the flowers of the jasmine plant are the poisonous part. Moreover, some plants are confusing because portions of them are eaten as food while other parts are poisonous. Household chemicals. Many products used daily in the home are poisonous if swallowed. These products often contain strong acids or strong bases, alkali. Toxic household cleaning products include the following. We have the ammonia, the bleach, the dishwashing liquid, drain openers. Signs that a person has swallowed one of these substances include evidence of an empty container nearby, nausea or vomiting, and burn on the lips and skin around the mouth if the substance is a strong acid or alkali. Causes and symptoms of poisoning. While signs and symptoms of poisoning can vary depending on the types and factors, there are a few common symptoms to be aware of. We have the dizziness, disorientation, vomiting, trouble breathing, pain, headaches, feeling faint. Diagnosis of poisoning: changes in behavior, hallucination, or other psychiatric symptoms may indicate poisoning by a hallucinogenic plant. Evidence of an empty container or information from the victim is helpful in determining exactly what substance has caused the poisoning. The vomit may be tested to determine the exact composition of the poison. Treatment and prognosis of poisoning. Treatment for poisoning depends on the poison swallowed or inhaled. From acid, alkali, or petroleum products poisonings, the person should not vomit. Acid and alkali can burn the esophagus if they are vomited. The petroleum products can be inhaled into the lungs during vomiting, resulting in pneumonia. Contacting the Poison Control Center or hospital emergency room is the first step in getting proper treatment. The Poison Control Center will ask for specific information about the victim, and the poison then give appropriate first aid instruction. If the poison is to be taken to a hospital, a sample of vomit and a poison container should be taken along if they are available. Once the victim is under medical care, doctors have the portion of the treating the person with a specific remedy of counteract the poison antidote, or with activated charcoal to absorb the substance inside the individual's digestive system. In some instances, pumping the stomach may be required. This technique, which is known as gastric lavage, involves introducing 20 to 30 ml of tap water or 9% saline solution into the person's digestive tract and removing the stomach content with a siphon or syringe. The process is repeated until the washing are free of poison. The outcome of poisoning varies from complete recovery to death and depends on the type and amount of the poison, the health of the victim, and the speed with which medical care is obtained. Prevention of poison. The ways in which poison can be prevented include removing plants that are poisonous, keeping medicine and household chemicals locked and in a place inaccessible to children, keeping medications in child-resistant containers, never referring to medicine as candy, keeping cleaners and other poisons in their original container, disposing of outdated prescription medicine, not purchasing over-the-counter medications with damaged protective seal or packaging. Avoid the use of herbal preparations not made by a reputable manufacturer. Parents should monitor the activities and substances to which their children are exposed. The number of the nearest poison control center should be posted nearby to every telephone in the house. Thanks for listening.